Hi, I'm Delaney. This video I'm going to demonstrate how to discontinue a primary line saline locket, push an antibiotic, and then discontinue my IV completely. So I would come into the patient's room, perform hand hygiene, and put gloves on. I would be checking for all my orders, which I have here, check them against the MAR. I would come in, make sure I have the right patient. I'd be checking their IV site once again, making sure no infiltration or phlebitis, making sure the patient's not in any discomfort. So the first thing I'm going to do is saline lock the IV. So I'm closing the clamp and taking the tape off the tubing. And if it's really sticking to the patient, I can use an alcohol swab to loosen it from the skin. And I can just untwist the tubing from the port and disregard my and I need to flush. With 5 ml of normal saline to saline locket. So now my IV is saline locked. So I need to document that, of course. Now I'm going to push Dilaudid 2 milligrams every 2 hours as needed. So for every 2 milligrams of Dilaudid, you dilute with 2 mLs. So I want to make sure I have my syringe and needle ready. And I have my normal saline and my medication. So I want to clean the top of my medication. And I can pull up that first. Okay. And then with a clean alcohol swab, I would also clean my normal saline. And I can pull. I'm pulling 4 milliliters of this. I'm going to recap my needle using the one-handed technique. Clean my port. And flush before I get the medication. I'd be telling the patient that we're giving a pain medication. Before I give the medication, I need to know the push rate when we're pushing, which is you can only push 1 milligram every 2 minutes. So you take off your needle, it's sterile, we've flushed, you hook up your medication, so we can only push 1 milligram per every 2 minutes, but for the purpose of this video, push some medication, and hook your medication and flush again. So we'd be assessing the patient, making sure they're okay. No phlebitis, no infiltration. This would go in the sharps container. Clean up our site. This is saline locked. We gave our pain medication. Then we would leave the room and document. So perform hand hygiene and document. We would come back in the room later because now we have an order to discontinue the IV. So same thing, wash our hands, put our gloves on. Double identify the patient, check our order that we are supposed to be discontinuing the IV, which we are. So now we're just going to tell the patient that you're getting ready for discharge or whatever the cause is, so we're going to take out your IV. So we want to make sure we have gauze ready and tape. And if they can, we can ask them for help when it comes time to hold pressure so that they're involved in the process. And depending on how much they're bleeding, we might need more gauze. Okay. So this is going to hurt a little because we're ripping this tape off, and then we're just going to pull this IV out, okay? Chevron. And then pull the catheter out. It needs to go in the sharps container. Hold pressure. And if they can hold pressure, they can do it themselves for 2 to 3 minutes. And apply tape or Coband if you have it. Then we would document the process when we leave the room and perform hand hygiene.